Cancer. I mean, just the word is enough to really send a lot of negative vibes and negative emotions. In this episode, we'll go for a deep dive into the leading causes of cancer, some of the latest treatment options, and even more. Now, welcome to the HealthLinks podcast presented by the HealthLinks family of services. I'm your host, DJ Thatcher. Our mission here is to engage in conversations about the medical and wellness landscape of South Carolina. And we're joined in this episode by Dr. Emily Touloukian, a board-certified oncologist, hematologist, and internist. Dr. Touloukian, welcome to the HealthLinks podcast.
Thanks for having me.
Now, before we go any further, just for the people who don't know specialties, hey, what is an oncologist, hematologist, and internist?
Well, an internist treats all sorts of diseases. They're typically your primary care physician, all the way from diabetes to high blood pressure to high cholesterol and everything in between. And oncology and hematology are subspecialties of internal medicine. Hematology is specifically focused on blood disorders, and then oncology is the treatment of patients with cancer.
So you are with the Coastal Cancer Center in the Myrtle Beach area, and you've been there for quite a few years. Now, as we produce this podcast, it is the middle of March, and for a lot of people, it's all about March Madness, you know, the NCAA men's basketball and the Final Four and so forth. I'm not going to ask you for your predictions, but, you know, a lot of people are really caught up in the stats of their team, the stats of their players, and so forth. They know little or nothing about the types of the top maybe 4 cancers, how to prevent them, treatment options, and so forth. So in 2025, what are the leading causes of cancer, the top cancers these days?
So for women, breast cancer, lung cancer, and colon cancer are the top 3. And for men, prostate cancer, lung cancer, and colon cancer as well.
Interesting. You know, lung cancer, I know for many years was number 1, and now it's taking it to second place or so.
Yes.
Is that because there's less occurrence of lung cancer, or is it because the diagnoses and the early detection of these other cancers, combination?
Well, thankfully, we are finding a lot of cancers earlier than we were. There are additional screening tests available for cancer, specifically lung cancer. Screening has been available in the recent years where it wasn't before. The Surgeon General came out with the advice against smoking that it caused cancer, and that it took us a while to catch up to that.
Sure. So as we look at March, not only is it the Final Four and March Madness, but it's also Colon Cancer Awareness Month, right? You know,
Correct.
We should put a big focus on that right now. Tell us a bit more about that, like the prevalence and everything else that's going on.
Yeah, so colon cancer is the 3rd most commonly diagnosed cancer in men and women.
Okay.
And it's being diagnosed earlier and earlier in patients. And in fact, the screening for colon cancer, the age at which we start screening, has recently been decreased from 50 to 45.
I heard that. We're going to get into that more in just a moment. Let's first, obviously, you're well-established and credible. Tell us a bit about your education and also how you ended up being drawn into the hematology-oncology world.
Yeah, so I started my training in Chicago, where I went to medical school and did my internal medicine training. Then I finished my training in Michigan, and I've been in South Carolina for the last 13 years.
So obviously you're well qualified. Tell us a bit about your education and what drew you to oncology hematology as a specialty.
So during my internal medicine training, I actually spent some time rotating through different specialties of internal medicine, spending time learning about those different modalities, the patients, and the treatments. And one of the things that really struck me about oncology was the relationships that the doctors have with their patients. And that's one of the things I really enjoy about treating cancer patients, is getting to know them, to know their families, what their goals are, and what they are, and helping them to achieve that.
So obviously you're well educated, but also you've done a lot more as well. You're one of the past presidents of the South Carolina Oncology Society. What is the society all about? What do they do?
So one of the things we do as a South Carolina Oncology Society is we network throughout the state to help really get cancer patients in South Carolina the best care that they can. We advocate for legislative issues to help patients get treatment faster, to get treatment prior authorized by insurance companies in an efficient fashion so that our patients can get high quality care more quickly.
Now, besides that, you're also the president of the Medical Society of Horry County. You're on the teaching staff of the residency program at Grand Strand Regional Medical Center, obviously for your specialty, I guess, in that, right?
Yeah, so we host the residents in our clinic. And we help educate them about hematology, oncology, the treatments, and the patients. I think it's a really important part of any physician's daily life is giving back to the residents, and training the next generation of physicians is really important. And we at Coastal Cancer Center make that a top priority.
Pay it forward, in other words.
Absolutely.
Huh? I love it.
These guys are going to be our doctors someday.
That's right. That's right. Yeah. Now, also, you were appointed to the Commission on Cancer as well. What's that all about, that group?
Yeah, so the Commission on Cancer is one of the quality initiatives in the country that helps maintain certain levels of quality throughout different cancer treatment organizations.
Okay, good. All right, so obviously we've established your street cred here. Now, I say that because going back to the fact that this is now Colon Cancer Awareness Month, a lot of people are really good about getting screenings, getting a colonoscopy when it's recommended, and so forth. Then there are the rest of us who are a little bit tougher. And a few episodes ago, I was fortunate to interview one of the GI specialists, the gastrointestinal specialists, who actually do the colonoscopies. And I asked him, hey, how critical is it for somebody in good health without a family history to go through this, kind of like 2 day between the prep and the procedure colonoscopy? How do you respond to that? I'm sure he gets a pushback from patients like me, I bet,
Yeah, I would say it's incredibly important. It's actually the most important thing.
Is it?
You want to get screened when you're asymptomatic so that we can find cancers earlier when they're more treatable.
Gotcha.
More likely to be cured.
How about the non-invasive tests that are out there, the Cologuards? I think there are some blood markers now or something. I'm not sure what else, but what's the efficacy of those? Are they okay? Or what's your opinion?
Cologuard is really the other alternative to colonoscopy. It's a stool test. So you get a kit, you collect your own stool sample and you put it in the kit and mail it in, and they can detect certain amounts of different things in the stool that help to indicate yes or no, or do you have cancer, are you bleeding?
Okay.
If that test is positive, then the follow-up test is a colonoscopy.
Colonoscopy, either way. Yeah. So obviously not as specific, but is it a decent tool for people who are asymptomatic, or you still pretty rigid on the, starting at age 45, getting that colonoscopy?
Yeah, I think it's a reasonable alternative, but the gold standard really is colonoscopy.
Gotcha. How far apart is it? Every 5 years, or what is the current recommendation?
Yeah, so it depends on what they find.
Okay.
So if they find precancerous polyps, they may say 3 years or 5 years. If you have absolutely no polyps, it may be 10 years.
Oh, really? Okay. All right. So want to get that part out of the way, because you're talking about colon cancer, it's the first thing, and some people just, give that pushback, I know. So what else as we focus on Colon Cancer Awareness Month? What are some things that people can do just to decrease their risk of this? Yeah. Diet and so forth. What are some recommendations there?
Yeah, so risk factors for colon cancer sort of fall into two categories. You have non-modifiable risk factors, like age and family history. And then you have modifiable risk factors. This is what you're talking about, right? So modifiable risk factors include things like a diet high in red or processed meats. That's a risk factor. Exercise can help to decrease your risk of colon cancer. Being sedentary is one of the risks.
Sure.
Smoking and alcohol consumption also increase your risk of colon cancer.
These days, that's got to be a given, right? Just, put that on the top of the list. Get off that.
It pretty much checks the box for
right,
cancer.
everything, right?
You're absolutely right there. But those are some of the things. Maintaining healthy weight and lifestyle can decrease your risk of colon cancer.
Sure. Even though we're focused on colon cancer, I'm sure that's the same for the other cancers as well. Is there anything specific for the women, for breast cancer, the men, prostate cancer, anything else there that could be a contributor to those, besides obviously your heredity and so forth?
Yeah, so for breast cancer, there are some hormonal supplements that have been proven over time to have a higher risk associated with breast cancer. And for prostate cancer, again, screening. Same thing for breast cancer, screening. Those are going to be the most important things to help us find these cancers earlier when they can be cured.
Good. Now, as we said, smoking, that's got to be on the list. Get rid of that. But besides that, it would be great if everybody would follow a Mediterranean diet or maybe a Far East diet, Japanese seafood diet, things that have had studies that have proven to reduce our incidence of all sorts of diseases. But let's face it now, we're practicing in South Carolina, which has one of the highest rates of every illness, going down the list. What are maybe your top 3 recommendations for South Carolina? For example, I read this statistic recently. It said for every French fry that you eat, it's the equivalent of smoking 1 cigarette. I'm not sure if that's accurate. It seemed really bizarre, but I imagine it. Fried foods and things like that. What about the average South Carolinian? What are some things we could do besides quitting smoking, to really cut down on our risk of any cancer?
Yeah, so I think you hit it on the head. It's those lifestyle factors, right? It's that Mediterranean diet that you mentioned is really the only diet sort of program or a regimen that's been shown to decrease risk for a lot of different diseases. So, a healthy, well-balanced diet, low in fried foods, low in those refined carbohydrates, things that are whole grains, fruits, vegetables, more of that in your diet, the lean proteins. Physical exercise is another one.
Sure.
Maintaining activity and less sedentary throughout your day.
A lot of people, when we mention exercise, when I interview cardiologists and so forth, exercise, of course, helps any of us, but they think they have to join a gym or really work out. It could be as simple as just walking, X number of minutes a day. Is that right? Anything else?
That is absolutely true. Exercise can be accessible to anyone. It doesn't have to be, joining the gym and doing some crazy spin class or Zumba or something like that. It really can be going for a walk every day and just being physically active is really important.
Terrific. So let's focus on the colon cancer right now. So what are some of the treatment options we have out there? Now it's 2025. What's on the cutting edge? Obviously, there are the things like chemotherapy and so forth. But what are you using these days?
Yeah. So cancer treatments in general have changed a lot over the recent years, and they've really improved. They've become more targeted. They've become more personalized.
Nice.
So surgery itself has become less invasive. They're now doing a lot of surgeries robotically instead of open through big incisions.
Right.
Radiation therapy is another modality used to treat cancers. It's become much more targeted, but much less side effects. And then systemic treatments, like that I give as a medical oncologist, things like chemotherapy, like targeted therapy, like immunotherapy. There are so many more options now that are less toxic. And what we're doing is we're really testing tumors to see if they have certain mutations or certain features that help us know what treatments that cancer will respond well to and which ones they won't.
Sure.
To help us select a treatment that will be the most effective for that patient specifically.
Historically, chemotherapy has been an infusion that you go to the hospital for and so forth. Today, I know there are some oral agents. It could be done at the outpatient setting, like in your office, or maybe even at home. Is that correct?
So thankfully, a lot of our infusional chemotherapies, IV therapies, we don't have to do in the hospital anymore. Most of them we can do in the outpatient clinic. And there are some oral options for colon cancer that we do utilize. A lot of those targeted therapies that I spoke about are oral medications. They're pills. Some of the chemotherapies are actually pills. And then immunotherapy is another option as well for some specific colon cancers with certain features. And that is an IV infusion that's given in the outpatient.
Interesting. I'm sure that's the same for the other forms of cancer that we talked about as well. Correct?
Absolutely. Absolutely.
All right. Tell us a bit about the Coastal Cancer Center, because it is a one-stop shop. I mean, you've got a group of physicians, you've got physician assistants, nurse practitioners, you've got the full array on-site infusions, a pharmacy, imaging, and everything. Let's brag about that for just a moment.
So yeah, Coastal Cancer Center was founded in 1982. So we've been around for over 40 years. We have 6 offices throughout the Grand Strand. We have 4 medical oncology offices and 2 radiation oncology offices. 7 medical oncologists, 8 APPs, which include nurse practitioners and PAs, and 4 radiation oncologists. And as you mentioned, we do have an in-house pharmacy, which is a great resource for our patients.
Sure.
Even if they don't get their medications at our office, our pharmacist is there to be a resource for them. If they have questions about their medications, if they miss a dose, when to take their next one. And the in-house imaging, you mentioned, we have CT scans and PET scans in 2 of our offices, which again makes it simpler for our patients to get things scheduled and get things done. And then we also have in-house infusion in all 4 of our medical oncology offices.
It's a great website, by the way. We'll make sure we have a link down below here. I know that, as you mentioned a few moments ago, much of what you do is patient-centered. It's customized for each patient. And so they're walking through the whole treatment program, whether it's radiation therapy, chemotherapy, or something else. Is that correct?
Yeah, I mean, as a community cancer center, that's really one of our goals, is to be able to provide patients high-quality care close to home, so that they don't have to travel an hour to get their treatments or, to another center. They can really get treated in their community by the people who live in their community. And to me, that's really important, to not have our patients traveling when they don't feel well to get treatments. They can get high quality treatments right here in their community.
Terrific. We have quite a few people who watch the HealthLinks podcasts who are in medical school or maybe nursing and that sort of thing. Are you seeing a shortage in hematology oncology for physicians there, like many other specialties, or is there a big draw to that? What's that look like?
So I think nationwide, we're seeing a physician shortage sort of across the board. And as we mentioned, age is the #1 risk factor for all cancers.
Exactly.
People are living longer, which is a great thing.
Right.
But that is the #1 risk factor. So we are seeing increased numbers of patients diagnosed with cancer just because of that.
Terrific.
So we have 2 new medical oncologists starting with us in the fall, which will be wonderful.
Nice.
So we'll be able to serve our community at a bigger capacity.
So how did you end up here in South Carolina? You started in California, Chicago, and other areas?
Yeah, so I was pretty tired of being cold.
Okay, simple. Next.
No, but I was really looking for an independent physician-owned practice to join.
Okay.
I thought that was one of my priorities. I wanted to be able to make decisions about how I was going to treat my patients. I didn't want to be told how to treat my patients. So that was something that was really important to me. And when I found the physicians at Coastal Cancer Center and I met with them, I talked with them about how they treat their patients, how they are members of the community, I really liked what I heard. And I was like, this was something I wanted to be a part of. I want to be a part of a physician practice that can make decisions about their patients independently and can really truly serve the community in which they live.
Wow.
And we've really done that. We've done colon cancer awareness events. We did one earlier this month. We do screenings for patients. Really just to be an integral part of the community was really important.
How do you keep up this active lifestyle? I mean, not only is it the practice, but also the other organizations that you're a part of. And as we record this podcast, we are at the sanctuary at the beautiful Kiowa Golf Resort. You're here for a medical conference, I believe. Is that right?
That's right. And I think it's something that's really important that physicians are leaders in the community and they are leaders throughout the oncology world. And thankfully, I have great partners who cover my patients when I'm not there so that I'm able to do this.
Sure.
Because I think physician leadership throughout oncology, through oncology practices is incredibly important. So we're there on the front lines talking to the patients, and we should be helping to make the policies that apply to those patients.
Terrific. Well, we've been speaking with Dr. Emily Touloukian from the Coastal Cancer Center. Dr. Touloukian, thank you for joining us on the HealthLinks podcast.
Thank you.